Coming up today, life after transplant isn't always life as it used to be. How this young woman endured serious setbacks just as things were getting back to normal. Good morning. I'm Jessica Lovell, and welcome to the Morning Medical Update. By the time Amy Reinhart turned 30, she had already endured kidney failure, dialysis, and thankfully, a kidney transplant. After such a rough road, she was finally starting a new job, moving into her own apartment, ready to live a full life again, until she found herself back in the hospital, fighting a new infection and juggling emotions of grief, shame, anger, and fear. Life after transplant has its own hurdles. So how do you keep the faith and hope alive? Well, we are asking Amy herself, who joins us again in studio this morning, because Amy, you were right here in this same seat about a year ago talking about that transplant, and we're so glad that you're back here with us today. How are you?
I'm good. Yes, I can't believe it's been over a year, so I'm very happy to be back here.
Well, we're glad you're here, and you have more of your story to share, so thank you for being here with that. We also have Lizzie Wright with us, Program Director for Turning Point. Turning Point is a group focused on emotional, social, and psychological challenges that often come along with chronic illness. So, Lizzie, always good to have you.
Thank you for having me.
Amy, before we catch up, I want to recap the story so far. As we mentioned, at age 27, kidney failure came as a surprise, I would imagine. What symptoms were you feeling?
Let's see, about a month before I was admitted to the hospital, I was just having, fevers, vomiting, diarrhea, fatigue, and what I now know was restless leg syndrome. So just these bizarre symptoms, and I thought it was the flu, I thought it was COVID, but then after getting blood work done, I found out my kidneys were failing and to get to the ER immediately.
So doctors tell you you have this rare autoimmune disease attacking your kidneys. So what did they tell you about this rare disease?
Well, I went into the ER on a Wednesday, and by the next morning, I had a kidney biopsy. And by that weekend, we had the results back. So it was an autoimmune disease called Goodpasture syndrome, which I had never heard of. And they said, this is an autoimmune that attacks your lungs and kidneys, which made sense given what I was experiencing. And they told me in all likelihood I would need a kidney transplant, which was, quite shocking.
So what was day-to-day life like for you while waiting for that new kidney?
Well, I would say, the first 6 months were very turbulent. I was in and out of the hospital. I had started a chemotherapy drug that made me lose my hair, and I was on hemodialysis, which was very much a roller coaster. But after I switched to peritoneal dialysis, which was done at home, it became a little easier because I was back in my own space. And I just did the dialysis at night. And so I got a little bit of my life back, but it was still a struggle day to day.
It was tough because normally you're an extrovert. And I would imagine hard to be an extrovert when you have everything going on, wasn't it?
Yeah, it was.
So you turned to Turning Point. How did they help out?
Yeah, so it was actually my social worker who told me about Turning Point. And since I was isolated at home due to dialysis, having the virtual option of these classes was so wonderful, and they had so many different options. And so I really took advantage of that and was able to connect with a lot of other people who were dealing with chronic illnesses like I was.
Lizzie, Turning Point does not prescribe medication. You're not finding people new kidneys, but you have so much to offer. Explain how you're helping people like Amy make those connections.
Yes. So Turning Point, we provide programs and classes for anyone living with a serious physical illness and their supporters. And we have a ton of Zoom classes. That was a COVID change, and for the better because we're reaching more people. But we have everything from some traditional support groups to meditation mindfulness classes, some of the writing classes that I know Amy has taken advantage of, art therapy. So really, you name it, it's try to offer a well-rounded option of programs for people.
When we think of grief, a lot of times we think of when somebody passes away, we associate it with a big loss. Explain how grief and what it means in the context of a kidney transplant.
Yes, with a kidney transplant or really any significant illness or treatment plan, grief is really the loss of the life that you thought that you were going to have. maybe the general experience of, okay, I thought I was on this road and then I got this significant diagnosis and that changed things. So there's a grief there, that big change. So really it can be the life that you thought that you were going to have and all the changes that come with it, the physical and emotional changes that come with an illness.
You offer support for the patients, but also for families. How
Yes.
so?
Yes, so we have some specific classes for supporters, and they can take advantage of anything on our program list, but we have a group called Supporting the Supporters that's led by a clinical social worker, and they meet weekly, and it's really to provide that extra layer to the family members, because the disease process, we know affects the whole family, so they can take advantage of that or any other programs on our catalog list.
And we're going to talk about some of those in here in just a moment, but what were some of your favorite classes that Lizzie was mentioning?
Yeah, so I've always loved to write. So anytime they offered a writing class, I was definitely probably one of the first to sign up. I also really enjoyed just the mindfulness classes, and also, yeah, just anything that really dealt with the emotions and were, a good way to, process those emotions and talk about them with other individuals who were, experiencing the same thing.
And you have this, we have this, Turning Point has a packed calendar right here. So you can go there and look at this. There's something here every single day. I would imagine it's hard to find something on here that would not apply to someone, some sort of interest, all sorts of movements, like you said, art, writing. Mm-hmm. You could browse the program, calendar yourself, check out the Turning Point website. That website is kansashealthsystem.com/Turning Point. Go there and check it out. I mean, really just peruse and see if there's something on there that you can find and that really speaks to you. Amy, fast forward to August 2023, you finally received this kidney, and it was from a complete stranger who was just, I don't know, giving away their kidney. And it found its way to you. Tell me about this special person.
So I was very outspoken about, my need for a kidney, and it was actually thanks to a woman at my church who was willing to donate. And so we were able to enter into KU's paired exchange program. So she donated actually to a gentleman in New Orleans. And then I was able to get connected to Caleb, my donor. And so, yeah, August 7th, he had his surgery in Denver. And then they life flighted the kidney here to KU Med. And I had my surgery that same afternoon. So forever grateful that he just felt that desire to give. And when I ask him why, he just says that he's always been a very generous person and always looked for ways to help people. So I'm just so grateful.
And he is what we call an altruistic donor, just somebody who did not have anybody who was an intended recipient, but he just felt the need to give, and he ended up giving to you. So such a fantastic story. And his kidney worked. It worked really well. I know it was a painful recovery, though. Correct?
It was.
You had to adapt to steroids and anti-rejection medications?
Yes. So I was in the hospital for a week, and it was probably the toughest time in my entire journey. So yeah, adapting to the medications, there's a lot of side effects. The incision, was at the lower part of the abdomen, so that caused a lot of pain when it came to sitting up and walking. But yeah, I made it through, and after I left the hospital, day by day, week by week, things got easier.
Then fast forward again to 2024, less than a year after the transplant, you were back in the hospital. What symptoms were you feeling that made you realize you needed to get back in and see a doctor?
So I had actually just started a full-time job, and about 2 weeks in, I started experiencing severe pain throughout my back, abdomen, and I didn't know what it was. It was so strange, and I tried all the usual things to help resolve it, but it just was not going away. And I was also just having some, bowel issues, and yeah, I just did not know what was going on. So it was super strange, and went to the ER, and they didn't know what it was. So then, thanks to my nephrologist, he tested for this virus, CMV, and it came back positive. So he then had me admitted the following day.
So yeah, you were eventually diagnosed with CMV infection. At that point, you did not know what that was. You'd never heard of that, or were you expecting anything like that to come about?
I had heard of it, but I didn't really know much about what it was. But I knew that I was never exposed to CMV, but my donor was. But I didn't know that that meant for sure that I would get the virus, but it did.
But you did. And we caught up with your nephrologist to get his explanation of CMV and what it means for transplant patients. CMV actually stands for cytomegalovirus. Dr. Pablo Porto Carrero explained it's nothing really to worry about when your immune system is healthy, but when your immune system is suppressed, like after a transplant, CMV can take over and make you very sick. Here is what he had to say about Amy.
She presented again with fatigue, diarrhea, fevers. Her numbers were high, they were very high, and she needed IV therapy. She needed to be admitted to the hospital. We had to do a colonoscopy because she was having diarrhea. We had to prove that she had CMV on her colon, which definitely guides the therapy different than other organs. Amy has been fantastic. She's been a fantastic patient. I have probably around 5 letters from her, from Christmas, Thanksgiving, and other important dates. I know she writes, and she has a blog, which I invite everyone to read, where she goes basically from even days before a transplant up to today. So she will show you all the story and how good she did. And I think that's very important for patients because that's a way that we can see hope, right?
And Amy, CMV put you back in the hospital on the same unit where you were after your transplant surgery. What was it like seeing some of the same nurses again?
That was a very unexpected blessing, and it honestly made the hospitalization so much more, so much more doable, just because I had the same support I had, when I got my transplant. So they were excited to see me, but also a little sad to see me. But it was just amazing to reconnect and just know that I was in the best hands.
I love that your doctor was on the receiving end of all that writing you love to do, sending him all those cards
Yes.
on the holidays. That's so kind. You needed a central line put into your chest.
Yes.
And even after leaving the hospital, you had to give yourself an infusion, every 12 hours?
Yes,
What was
I
that
did.
like? How did that compare when you were managing dialysis?
Honestly, it was a lot easier, just because the infusion was only about, an hour, and I had to do it every 12 hours. So it was just, twice a day. And what was nice was the little machine that did the infusion was portable. So I could walk around while I was doing the infusion, which was very different because when I was doing dialysis, I could not leave my bedroom because I was connected and I would have had to haul the whole machine with me, which was not, not possible. So it was a lot easier.
A lot easy enough that you got to a wedding, I understand?
I did, yes. So such a blessing. My cousin Annie, she got married last summer, and so I was able to go, and I just had to do an infusion during the reception. As you can see, I was in the bathroom there, plugging myself in. But it was definitely, I was able to return to the reception, just kind of walk around with the machine, and then unplugged, and I was able to enjoy the rest of the time.
And you're taking photos and you're smiling, and we can see in all these photos. But you're very open about that. Your mental health was taking quite a beating. CMV meant that you had to quit your job, that you had just gotten. You had to move. You had plans to move into a new apartment, which was a really exciting milestone. What did those two big things mean to you?
It was, we talk about grief, and I definitely grieved over the loss of both those things because I really thought after recovering from my transplant that I could just restart my life. I could just go back to full time, I could move out, and everything would just be smooth sailing, but that was not the case. And so it was just very unexpected, and like you said, it really caused my mental health to take quite a beating.
We talk about grief. That's a huge loss.
Yes.
And that's what you were talking about Lizzie. This is just a huge bump in the road. How important is mindset, resilience, and support when facing a setback like this, when you're kind of trucking along and thinking you're out of the woods, and then you have to go back and feel like, okay, why me? I'd made it so far, and now I'm back here doing it all over again.
Yes. I mean, it's exactly the reason we exist, because it's hard, and all the things you talked about. I mean, resilience is, we always say, the ability to bend without breaking, but that's not being, excessively positive and saying everything's fine. It's coming in with how you are, like, I'm having a bad day, and still going to the wedding, but also reaching out for support either through Turning Point or a counselor or whatever that looks like. So yeah, a lot of our participants come in feeling that way and need some guidance on how to do that, on how to get to that.
So let's dig in a little bit more on the how, because here you are sitting here today. But for somebody who maybe isn't the beginning part of their journey and is trying to get to trying to get to Turning Point and to get to those spaces, how does someone get into that mindset so that they can start moving forward? What kind of advice might you have for someone to get there, to just take those first steps?
Well, something my social worker told me when I was first starting hemodialysis at the, in-center, she told me, Amy, this is a tough road. This is a tough journey that you're on. She's like, you're going to experience a lot of different emotions. And she said, I want you to know that every single one of those emotions is valid. And you need to, instead of ignoring them, pushing them down, you need to allow yourself to feel each emotion. So I think that's the first step, is just acknowledging that this isn't easy and this is hard. And, having those resources like Turning Point and friends and family and, your faith is huge. So I think, just acknowledging it is definitely the first step.
Lizzie, how can people verbalize it more and talk about it and feel comfortable talking about this? I mean, life's hard without a chronic illness.
Right.
Then you add this in. Where do people start?
I think, like Amy said, acknowledging that you don't have to do this by yourself, for one, that there are resources out there. And our families can be so supportive, but maybe you want to talk to somebody who actually has been through something similar. And that's where Turning Point can come in, is matching you to either programs or a diagnosis-specific support group, or just really tailoring those resources to fit, your needs. So, yeah, just reaching out, and that's hard to do, to reach out.
It is hard, but just take that first step. Hey, we want to take a moment just to say thank you so much to our viewers who send in questions and comments. Please keep them coming in. So if you're watching live right now and you have a question, you have a chance right now to ask something to our two guests. You can use the chat on YouTube or Facebook. You can email the Medical News Network. That information is right there on your screen. Amy, you mentioned it. You mentioned faith, of course, your friends. How has that played such a big part for you?
I mean, it's everything. It's the reason I'm here today. It's the reason I can smile and, still continue to find the joy. I have an amazing community of, friends and family. And, even though, none of them have experienced what I'm experiencing, they can still offer, that encouragement, that love, that hope, those words of affirmation, even a hug, goes so far. So I think that's, even though they can't, completely sympathize with, kidney failure and CMV and transplant, they can still, give me what I need in those tough moments.
What about professional help? How important is it to seek out professional help if you need it, counseling and therapy?
Right, it's extremely important. So after, when I was dealing with CMV, it was actually, Dr. Pablo, my nephrologist, who told me, Amy, you're experiencing some depression, because of this setback. And I really think, you should find, counseling. So I was able to, and, I saw this counselor for several months, and we just really talked through how I was feeling, the obstacles, and just kind of giving me that new mindset, that getting me back to a healthier place. So I think it's huge. I don't think there is any negativity or stigma surrounding seeking out therapy. I think it's, extremely helpful and can really give you some insight into, whatever you're facing.
And we've mentioned you've been blogging a lot on the website,
yes.
Caring Bridge, a lot of insightful posts. That has been helpful for you.
It
Therapeutic.
Has. Yes, very therapeutic. Yeah, like Lizzie said, it's, it's just getting it from here to hear. And it's just, yeah, it just feels like such a relief.
Lizzie, how important is that though for people to kind of get it out and onto paper or onto a blog and share experiences with others in the community?
Oh, it's so important and challenging. I think sometimes we don't have the language. Maybe you don't even know how you feel until you start writing, or maybe are doing some kind of art therapy class or something, and you're not really in touch with that, and then it just comes out. So it's just another tool that can be used to have another emotional expression. Yeah.
Something you wrote about, and it resonates with me because something of this year I've been ditching is timelines. Forget timelines. Timelines do not matter. You said that God helped you realize that you were not falling behind, like when you're comparing yourself to other people, like getting married or having kids, advancing in careers, like watching other people doing things and feeling like you're supposed to be doing something that somebody else is doing. How do you kind of educate us on that and kind of help us ditch the timelines and tell people who cares? You're on your own path.
I love the phrase, if you want to make God laugh, tell him your plans.
Right?
And that just, I always smile when I think about that because, after transplant, I had so many plans. I talked about them last time I was here. I had plans to, work full time, get my own apartment, travel, all these things. And really, none of them have panned out. And there's a lot of disappointment there and discouragement. But when I look at, my friends and family who are doing these things that I'm not able to do yet, instead of, being prone to jealousy, I just really challenge myself to, just feel happy for them and be the cheerleader that I love to be. And just know that my life is different. At 31 years old, this isn't the life I thought I would have, but it's still a good life. I have so many things to be thankful for, and just knowing that I'm moving at my own pace, and that's okay. That's really okay.
How important is that lesson, Lizzie, for people who are dealing with chronic illness and have to take kind of a diverted path to go and take care of themselves and then have to jump back on the road and maybe have to set things to the side and then jump back on the road again?
Absolutely, yes. It's a hard lesson to learn, and I'd say you don't have to go on that road by yourself. I mean, that is why it's so important that you're speaking out and speaking so eloquently about that experience. So I think, just saying something to either your medical team or somebody that can get you in touch with those resources to support you through that, because it is an emotional roller coaster. I think that's what we hear most often.
Okay, so put those 31 years behind. What are you looking forward to now? Like, what's something that would really be exciting to look forward to?
Oh, goodness. I would say it's not really the big things anymore. I think what I've learned is don't expect, such and such to happen. Instead, just look forward to the smaller things and, just find joy and peace in that and not rush into the future. Don't have your mind in the future. Have it right here in the present moment, because the future is not guaranteed. And like I said, our plans are not guaranteed. We just need to take each day as it comes and each moment as it comes.
Oh, I love that. I love that today. All right, let's get to some questions from our viewers this morning. Stuart wants to know, how did the pain and symptoms of CMV compare to kidney failure?
That's a good question. I would say, I feel like since CMV happened more recently, I feel like that was honestly more painful than the initial kidney failure. But, they were both, definite, crosses. And a lot of the symptoms, crossed over between the two. But yeah, I would honestly almost say that CMV was harder because I'd restarted my life. And then to have this, setback happen, have this hospitalization happen, it was more devastating than the initial hospitalization back in 2021.
Another question, are you still doing the infusions?
I am not, no. I only had to do them for about a month or two. So yeah, by the time, fall hit, I was done. So yeah, they worked perfectly. So
Couple of nice comments this morning. One from Gene. Gene, thanks for watching this morning. He says, great life lesson from this program. So people are listening and have some nice takeaways from that. Jeremy says, even if you know on paper that you're not alone and aren't the only one, there's something so helpful about actually interacting with people going through similar things that makes you feel less isolated. And there's something about helping someone else who has the same struggles that make your own feel lighter. Thanks so much for the Turning Point program. So, Amy, what was the most surprising part of your healing journey? That's a question from Mary.
Most surprising part, I would say just learning how strong and brave I can be in the midst of suffering. I mean, some of the things that I've gone through in the last 3 years, I never in my wildest dreams thought I could, go through these things. And, being on the other side, I look back and I'm like, wow, like I really do have the strength and courage to, do these things and make it to the other side, feeling this peace and joy and hope. So I was very surprised just by how it changed my perspective and just how I look at things now.
Mary has another question. I'm not sure if you know the answer to it, but I'm going to ask it anyway.
Sure.
Do you know how your donor found the kidney donor program that helped you out?
Honestly, I am not completely certain how he did, but I know that one of his grandparents did suffer and pass away from kidney failure, so I think that was the first kind of spark for him. And so, yeah, I'm sure after that, he probably, just reached out to, local hospital and probably just, questioned about how he could, get listed. But that's a good question. I'll have to ask him.
But interesting, that he was the altruistic donor, maybe had some sort of life experience that led him to you.
Right,
ultimately.
to me, yes.
Lizzie, what's the big takeaway from our conversation today?
I think the biggest takeaway is just to reach out, make that first step. We meet with new participants that come into Turning Point and they're not sure really what they want or what they need. So we really talk that through. I'm a social worker and a coworker is a social worker. And there's so many classes. There's over 100 classes during a 2-month period. And they're also free of charge. I don't know if we mentioned that. And you don't have to be affiliated with KU at all to take our program. So even if you're tuning in from rural Kansas or out of state, you can still take advantage of our programs.
Great. Thank you for being here and talking about it. Amy, what is the big takeaway from your story?
I would say, life is hard. Life is hard. And we go through obstacles that we never expected to go through. And I think, just like I said, acknowledging that, acknowledging every emotion that you feel when going through these times of, suffering and whatever type of suffering it is, physically like mine, emotional, mental, spiritual suffering. It's, you're doing the best you can and nobody suffers perfectly because we're human. And so I think just acknowledging that and knowing that you're not alone and that there's resources and, people that care and want to help you. And just you're not alone. You're never alone in it. And I know that more than ever now. So.
Well, thank you for being here, sharing your story again.
Thank you.
People are listening, and you're changing lives, so thank you. Thank you. Come back anytime.
Yes,
thank you both.
You.
Thanks to all of our viewers for watching us today. We'll see you back here tomorrow. Have a great day. Your genes hold clues to your health, and it's time to get clued in to your personal cancer risk. I'm Jessica Lovell on the next Open Mics with Dr. Stites. The push to be proactive when cancer runs in the family. How knowing your genes can protect you and your kids. Wednesday at 8.
Subscribe to our morning medical update and Open Mics with Dr. Stites podcasts. Now, everywhere podcasts are available.